We now welcome Dr. Kritika Devi ma'am for the next presentation. Is healthcare being female dominated? Kritika Devi ma'am is a managing director and consultant OB-GYN at Babu's Maternity Hospital, West Tambram. She is the chairperson of the Women Doctor Wing and she is the district coordinator of PPLLS. She is a coordinator of MPH and her field of interest is high-risk pregnancies and infertility. Over to you ma'am.
A very warm good afternoon everyone present here, and my thanks to Dr. Karthik Prabhu, TNSB Secretary, for being here and supporting us for this session. My topic today is very unique, that's what I was thinking, but Dr. Umayal and Dr. Priya Kannan, they've already covered all my slides. I don't know what am I to talk right now. So let me complete my topic briefly. Is medical profession female dominated? There is a rising presence of women in the medical profession, but the question remains, is the medical profession in India female dominated? So let's see what the data says. According to Times of India, women comprised 50% of the medical college admissions in 2014 to 2015. But this figure reduced to 1/3 at PG and doctoral levels. So surprisingly, out of this 50%, only 17% of the doctors are practicing. Experts say this could be because women even today have to struggle to balance work and family responsibilities. So what does the fact say? In 2020, women constituted around 47% of the Indian medical workforce. The Indian medical workforce means the doctors, staff nurses, lab technicians, OT technicians, and even the housekeeping women. They comprised of around 47%. NMC says women constituted around 55% of the medical students in the country. Female doctors, they dominate only in certain specialties like obs and gynae, pediatrics, dermatology, anesthesiology. We do have doctors right from ancient days, lady doctors. Metrodora was a Greek physician. She lived between 200 to 400 AD. She was the author of the book on the diseases and cures of women, and she was the first physician to recommend surgery for both uterine and breast cancers. When we come to Elizabeth Blackwell, she lived between 1821 to 1910. She was the first woman to earn a medical degree in the United States. Yoshioka Yayoi, she lived between 1871 to 59. She was a doctor, women's rights activist from Japan. She in fact started her own women's medical school graduates, but she was not, the doctors were not allowed to practice medicine legally until 1912, and later on the Japanese government began allowing women to take the national and medical examination. How can we forget Virginia Abgar? She was between 1909 to 1974. She was an American anesthesiologist. She spent the last 15 years of her life working with the March and of Dimes Foundation. She and Joanne Beck co-authored Is My Baby All Right? A popular guide to birth defects, published in 1972. So what are the challenges faced? Dr. Priya had briefed nicely about this. Gender bias and stereotypes still exist, influencing career choices and opportunities. Gender bias, the research has shown that gender bias can influence diagnosis, treatment and pain management. Female physicians are often stereotyped as being more empathetic, more communicative. They spend a lot of time with the patient. They probe into details for the diagnosis, whereas their male counterparts are more competent and authoritative. So the stereotyping have been done only this way. Gender disparities occur in the career advancement, including leadership opportunities and lower salaries. So the lady doctor faces obstacle in pursuing surgical specialties and leadership roles. Doing surgical general surgeries, people prefer more male doctors than a lady doctor. So, what are the gendered expectations? Patients and colleagues often hold gendered expectations. Females are more nurtured and male physicians are more competent. Gender disparities occur in the mental health of the woman doctor also. They face higher rates of burnout, depression and anxiety. Work-life balance has to be done among the woman doctor. Lack of support for work-life balance, so they often fail to support work-life balance disproportionately, affecting women who bear more caregiving responsibilities. So when 100 women were asked what are the biggest barriers for the career advancement, around 10 to 20% only said the educations and skills were the barriers, but around 50% of the ladies commented that they lacked self-confidence. So modern problems require modern solutions.